Hi, I'm Jonathan Esquivel. I'm a prosthodontist in New Orleans. Nowadays, it's very common to do CAD/CAM implant-supported restorations due to the vast quantity of chairside CAD/CAM milling units. If we're going to be doing our own restorations in our office, it's very important that as clinicians, we understand how to select the right tie base, because this tie base is going to have a direct influence on the aesthetic outcome and the biologic outcome of the case itself. If the platform of this tie base is too close to the crest of the bone, it may lead to remodeling around this implant neck. But if it's too close to the gingival margin, well, we're not going to have enough space to develop that nice emergence profile from that narrow neck of the implant to a much wider neck of the implant restoration. So next time that we're going to select a tie base, we have to remember these important considerations. Of course, the selection of this component is going to depend on the amount of soft tissues that we have from that platform of that implant to the free gingival margin of our restoration.